Accountability questions have been raised on government spending during the COVID-19 pandemic. Auditor General John Mwanga raised various audit queries. To date, some of them have never been answered. The Auditor General's report was submitted to the Speaker of Parliament. Meanwhile, Parliament was concerned about the expenditure, and so they set up a committee led by Abdu Katuntu and deputized by Honorable Dan Kimosho. The committee spent days going around the country to get to the bottom of the accountability issues. They too released a report that to this day still gathers dust somewhere in the shelves of Parliament. The Ministry of Finance, Planning and Economic Development too released a report looking into the COVID-19 money. And then came headlines like this. I am Rahim Nwali, an investigative journalist. I am reopening these cold files on accountability for COVID-19 cash to expose how companies and individuals profiteered from the pandemic. Let's get started. In this investigation, we will rely largely on the reports that were released by the Auditor General, the Parliament of Uganda, and the Ministry of Finance on COVID-19 expenditures. Let's start with food. During the first wave of the pandemic back in 2020, several people were admitted immediately after they tested positive, even when they did not have enough signs of the infection. In fact, some of the people who were admitted posted videos like this, dancing and playing cards in health facilities. The numbers began to swell day by day. The government had to provide food to people in quarantine centers. A company named MS Keba Investments Limited was contracted to supply food to all quarantine centers. Proper procurement procedures were not followed while contracting Keba Investments. There was no bidding process to give an equal chance to the suppliers to compete for this opportunity. It should be noted that Keba Investment was the same company that was and still supplying food to the Ministry of Health staff headquarters in Kampala. The Ministry of Health contracted MS Keba Investments Limited through a contractual framework to provide special meals for quarantined individuals, COVID-19 suspects, patients, treatment centers, and the National Task Force. The terms of the contract included provision of breakfast at 5,000 shillings, lunch and dinner at 20,000 shillings respectively. The contractor provided food for quarantined people and health workers at Entebbe Regional Referral Hospital, Ministry of Health Call Center, Fisheries Training Institute, DDA Training Institute, National Meteorological Training School, Institute of Surveys and Land Management, among others. It is perhaps important for us to note that MS Keba was the only company contracted to supply food to all quarantine centers across the country. A point to ponder. The variation in the numbers submitted in the invoices presented for payment is what raised the red flag to the Auditor General. The unit cost of food varied greatly. For example, in Arua Regional Referral Hospital, meals for COVID-19 patients costed Uganda shillings 62,000. That's 37,000 extra from what was agreed upon in the contract document. 15,000 shillings in Jinja, while MS Keba provided food for Entebbe Regional Referral Hospital, selected quarantine and treatment centers at 45,000 shillings. It was also established that MS Keba supplied breakfast, lunch and dinner at a cost of 105,000 per person per day at the Grand Global Hotel. Let that sink in again. On average, let's say 40,000 shillings for lunch, 40,000 shillings for dinner, and 25,000 shillings for breakfast. According to the Auditor General's report, MS Keba provided meals and breakfast to the National Task Force at 18,000 shillings and 6,000 shillings respectively. By 25th of June 2020, the contractor had made invoices for food of Uganda shillings 3.3 billion. Two issues emerge from the brief. 1. The cost of food supplied. 2. the number of people who are fed at the different centers. So how do we account varying prices? Let us get to the food which was supplied at the different centers. Daniel Utaya was in the quarantine center for 14 days. This is what he had to say about the food.
It was the normal food that we always eat in Uganda. It wasn't that fancy of food. It was not, Chinese cuisine or Western cuisine. There was no pizza involved. There was no cheese. Those sorts of things that would make a meal expensive in a country like Uganda. If it were me buying that food at a restaurant in Kampala, I would buy it at between 10,000 and 15,000.
Let us break it down. How much would this food have costed? As for Grand Global Hotel, what could justify the price of food at that cost, especially when the contracted rate was 25,000 shillings? When President Museveni said that some of the results from samples tested by the Makerere University Hospital were false. He said this, and I quote, "Some of the 679 confirmed cases were classified as positive when they were not found positive by a laboratory in Makerere because they were careless." The word is careless. Apparently, there were a few people working there and probably got tired. President Museveni said this statement back in June 2020. Let us crunch the numbers. 679 false positives who had spent 14 days in quarantine caused a financial loss of 42 million shillings. So we ask, could this rapid rise in COVID-19 cases during the first wave, including the false positives, have increased the government expenditure on food and therefore earn an extra shilling to MS Keba? When all is said and done, these issues were raised in the Auditor General's report, which has since gone silent. Rahim Nwali, AIIJ unveils.